Are you thinking about getting lip filler? Would it surprise you to know that women getting lip filler has gone up by 43% since the year 2000, but for men, it has gone up by 400%. Come talk nerdy with me. My name is Mougel. I am a board-certified nurse practitioner in Arizona. I primarily focus in aesthetics and wellness. One of the most popular things to use for lip augmentation is dermal filler. There are tons of different dermal fillers to choose from, but the most commonly used or popular for the lips is hyaluronic acid. Hyaluronic acid is a great filler to use for the lips because it is a substance that is naturally occurring in our own bodies. So the risk of an allergic reaction is really slim. Of course, there are lidocaine in some of the products, so if you do have any allergy to lidocaine, tetracaine, any of those kinds of numbing agents, you'd want to tell your practitioner that before you get your treatment. So what are the benefits to getting a lip augmentation with dermal filler? I would say the benefit would be if you are someone who has asymmetrical lips, one side's taller than the other side, the cupid's bow doesn't quite match, there are things that you don't like about them that you would like to correct. That's a good option. Another two, maybe you just had really skinny, small lips and you wanted something with a little more volume, or you were lacking some shape to your lips and you wanted to enhance that shape a little bit. My favorite though is the aging process. Dermal filler in the lips for aging lips looks really fantastic because you can give a more hydrated appearance, which will help smooth out the wrinkles in the lips. You can create volume if you want it. And then also as we age, our upper lip will start to kind of rotate under, and this philtrum area will continue to get longer. For every 10 years, about this area grows by 0.5 millimeter in length. You think about that over a whole lifetime, that is a lot. So as this continues to get longer and our lip starts to rotate under, you start to lose that upper lip when you smile. So you can correct that and improve that with lip filler as well. Now, why is it that you see some people that look like they have beautifully natural lips and then you find out that they had filler and you are shocked? Yet you can see other people where it looks like they've definitely had filler or something done to their lips because it doesn't look quite right. First, it is product selection. There are so many different products to choose from, but probably the most important thing is some of them are really, really thin and pliable, flexible, and then they kind of go up, getting thicker and thicker, more stiff, depending on where it is that you are going to place the filler. So as an example of what I mean by that, I'm gonna show you this cute little kit. So all the fillers that I personally like for the lips would fall in this category. And I'm showing you this category so that you can see how squishy this little gel ball is. And this is similar to the fillers that I'm talking about that are really flexible. They integrate really well with the tissue. They just have, you can tell it's really pliable. So this is what you want in your lips because when you're talking, you want your lips to move naturally. You don't want them to look stiff or like they don't belong. So I want to show you those thicker fillers that I was talking about. Look at the difference. I am still squeezing exactly the same. It is really stiff. You can't really even stretch it out. It's not very flexible. So you could see if someone was choosing this type of a filler to put in your lips, now you can see how you get that appearance that looks unnatural or stiff. That's because either product that was selected was too stiff or too thick for the lips, or there was multiple syringes placed. Talking about multiple syringes, I think it is best for the lips, for the tissue, to do one syringe at a time. So for those of you out there that don't want, huge lips, and you're thinking, oh my gosh, do I really want a whole syringe? If I take a whole syringe and squirt it out into a teaspoon, it's about 1/5 of a teaspoon of gel. Realistically, even if you had really tiny lips and you wanted to go to really full lips that had lots of volume, you're not gonna get that in one syringe, and you don't wanna do that in one session. I think doing one syringe of filler, allowing time for it to integrate in the tissue, swelling to go down, your tissue to adjust to having the filler in there. It is better to come back 2-3 weeks later, up to a month later, and then start stacking that next syringe of filler on top of that if you're wanting a lot of volume. If you don't want a lot of volume, that one syringe is going to be plenty for you. How long can you expect for the filler to last? Manufacturer says about a year. I think that a lot of that depends on how much movement there is in the area that you're injecting. So lips, obviously a lot of movement. And also how fast is your metabolism? Because the faster your metabolism, just like you burn off those cupcakes and donuts in the morning, you burn through product faster as well. So I think realistically, usually I tell my patients about every 6 to 7 months, come back in, and then we can reassess your lips and see, are you still happy with them? Are they starting to go down a little bit? And we can add volume then at that time just to maintain what you have, because it is easier to maintain and stack filler on top of each other because you'll wind up with a better duration that way than it is to have lips, then no lips, then put lips back in, and then no lips again. So when you're ready to get your lip treatment, what can you do at home before you come in for your treatment to help make the process easier? So 2 to 3 days before your treatment, you want to stop anything that would be a blood thinner. Of course, if it's okay with your physician, but I'm talking about things like alcohol, ibuprofen, fish oils, certain vitamins and supplements, all increase the risk of bruising and swelling. So if you can stop those beforehand, that will help. You can also start over-the-counter natural supplements like arnica. They have tabs you can do under the tongue. I like those because they're more systemic, but they also have cream and ointment that you can apply directly to the lips if you don't like to take something. But that helps with the risk of bruising and swelling. You can also start bromelain. It is something you find naturally in pineapple, but they have it in a supplement form as well, and it also will reduce any bruising or swelling. What you can expect during the treatment when you come, you'll have a numbing cream applied to your lips. It is an intense numbing cream, like really, really intense. So your lips will feel huge before we even start, and you will not feel much going on. So that helps to make the treatment a lot more comfortable. Of all areas, if you've never had any injections anywhere before, lips are probably the most sensitive area of anywhere else on your body that you would have injected. So we make sure that you numb for plenty of time so that you're comfortable throughout the treatment. There's also, like I had said previously, lidocaine in many of the fillers, certainly in all the ones that I use. So that helps each poke. It does get more and more comfortable. So very tolerable. Okay, so now for your post-care, what you wanna do, ice is your best friend, okay? So you're gonna ice, ice, ice. That first day especially, 15 minutes on, 15 minutes off, ice throughout the day. Continue your arnica and bromelain if you were doing those things. I like for patients to just add an extra pillow under their head at night, that first night, because that elevation will help with any additional swelling that you might wake up with in the morning. A reminder that swelling never happens even. And I say that because if you get done with your treatment, you're like, oh my gosh, they're gorgeous and they're perfect. And 3 days later, all of a sudden they feel like they're uneven to you. I want to assure you, give yourself a week for that swelling to go down and for the filler to integrate in the tissue, and they will be just as perfect as you remember when they were done. Don't forget to stay tuned for our next episode because I will be talking about adverse reactions, undesirable outcomes, how do you reverse lip filler if it's something that you didn't like, or anything like that. So you want to watch for that one. That one is really, really interesting. Until next time, talk nerdy to me.